When we test your toenail for fungus, we actually do so in 3 different ways. The first 2 tests are a type of stain, which essentially means that the tissue is stained and then the fungus will actually change color to make it pop out and more apparent when we look at it underneath the microscope. The third test that we run is called a PCR test that allows us to actually look at the DNA within the toenail, comparing it to fungal strains. This will actually allow us to see what kind of fungus is growing. Now, if one of these comes back positive, we can typically say definitively that you have toenail fungus. The most common type of fungus, if the PCR can tell us what is growing, is called T. rubrum. This is also the type of fungus that often grows on the skin, causing athlete's foot. And so we believe that that is most likely the origin in these situations, that the skin was infected first and then it traveled into the toenail. Now, when we have toenail fungus, you don't necessarily have to treat it or try to get rid of it. It will spread to the other toenails and it may cause chronic skin infections or athlete's foot, but it won't travel to other organs or be life-threatening. It can become painful if the nails do become extremely dystrophic or thickened. There are some people who have a very poor success rate at treating toenail fungus. This is typically people who are immunocompromised. So, for example, having diabetes or bad blood flow, neuropathy, those types of situations, we don't see good results. Though I do still encourage you to do proactive steps to help decrease the spread of it. And that's typically just applying a topical to the nail or the skin itself to help stop the spread of the fungus and to maintain a healthy thickness of the toenail. Occasionally you'll need routine debridements where we actually trim the toenail back or get rid of some of that fungal tissue within the toenail. Now, more often people are seeking a cure for the toenail fungus. You will see lots of advertisements and things out there for different things that you can apply directly to the toenail. Overall, in general, these types of treatments have a relatively low success rate. And when we're really seeking a cure to get rid of the fungus completely, we have 2 major options. One would be a pill and the second being a laser. Terbinafine or Lamisil, more commonly referred to, is the pill that we prescribe for toenail fungus. This pill has about a 75% success rate, which is not outstandingly high, but it is still a good treatment option. The downfall of this drug is that it's been on for the market for a very long time, and so we're also quite familiar with all of the potential side effects. The most concerning is that of liver damage, and so when we use this medication, we will actually do routine blood work to monitor the health of the liver to make sure that there is no damage. Some people cannot use this medication at all for this reason. For example, if you have a history of liver disease or if you're on some medications, we cannot use this in combination with those medications. Another great option, though, to treat toenail fungus is laser. It has a similar success rate to the pills, but it's much less invasive. It is a multiple treatment therapy, meaning that you have to have the laser procedure done at least 4 times, sometimes additionally. Now, the way the laser works is that essentially there's 2 lasers inside this laser that we particularly use that both actively kills the fungus in that area, but it also helps increase your immune system's response to being able to kill that fungus. I prefer to use something called a cold laser. The reason being that since it does not emit any heat, we reduce that risk of causing any skin or nail damage during the treatment, but it also allows it to be completely painless. Now, either one of these treatments can be very frustrating because it takes a very long time and a commitment. Most of the time it takes up to a year, sometimes even a little longer, for us to truly see the positive results of that fungus. primary reason is the nail is very slow to grow. It only grows about 1 millimeter a month. And so you can imagine tracking that process is quite slow. Therefore, there's a couple additional things that we do here at Third Coast Foot and Ankle to help guarantee that you're going to have a more positive result. One is that we see you every 3 months, monitoring the nail, taking pictures, making sure that progress is actually happening. And it's quite hard to see. That's why we take pictures. Secondly, I also prescribe and recommend other topical treatments that can really help promote discourage reinfection and promote healthy growing toenails. So in addition to laser or the pill, we are also going to use a topical medication on the nail. We'll use a medication on the skin, and then we'll also use a spray for the shoes to help eliminate fungus. There's also vitamins and oral supplementations that we can take that can improve the nail's growth, including both the rate and the strength of the nail. So thank you for choosing us to help you treat your toenail fungus or manage it if that is what you choose. We are very excited to help you through this process and get you that result that you want. If you have questions, and I hope you do, the doctor will be right in to review all of this with you again.